Every day, doctors, nurses, pharmacists, and hospital staff work around the clock to give patients the care they need, and they often rely on medications to help them deliver the highest quality care. But what happens when providers can't access the drugs necessary to care for their patients? In recent years, hospitals have found it difficult to obtain life-saving medications due to dramatic price increases and drug shortages. For example, medications used to treat persons with heart attack and stroke shot up by 18.8% from 2015 to 2017, increasing by over $650 per unit. Drug manufacturers took advantage of shortages of chemotherapy drugs used to treat cancer by hiking prices over 30%. Despite the potential dire consequences of rising prices and drug shortages, drug manufacturers just keep getting richer. It's no wonder they spend more on advertising than on researching tomorrow's cures. Meanwhile, hospital staff will continue to always put patients first. Doctors spend time working with pharmacists to find alternative treatments or change delivery methods. However, it comes at a cost. Rising drug prices and costly workarounds to shortages means that hospitals must make cuts elsewhere. The tough reality is that the strain of rising drug spending has resulted in hospitals reducing services, delaying critical investments, and rethinking staffing. It's time to reestablish the need to serve the public good and solve America's prescription drug crisis.